Good afternoon, guys. I've got discussion A for you. First one up today is an article. One simple practice dramatically eases the pain of dying patients. Skincare, not medication, is key. Thoughtful, immediate care of the skin around pressure sores can significantly improve comfort and even extend life for dying patients. Pressure ulcers, common and painful for immobile patients, often develop these wounds, which can become infected and cause severe discomfort. Research backed impact. A study led by nurse and professor Maribel Pasteur, Catholic University of Valence, Italy, found give me 1 second. I have to separate notes here. That patients receiving attentive skincare live longer, sometimes by several weeks, and experienced fewer infections. Human touch matters. Guys, when people are passing, the human touch matters to them because it shows them that somebody cares for them at the end of their life. Okay? That's a simple process. The article emphasizes that small, compassionate acts like skincare can make a profound difference in end of life experiences. Would you like to explore how this insights could be adapted into caregiver toolkits or culturally responsive end of life care frameworks? I'd love to co-create something with you. Okay. Next section, you're already primed to make this actionable, especially given your work with caregiver toolkits and culturally responsive frameworks. Here's how you can translate skincare practice into caregiving strategies. Practical applications for caregiving. Integrate skincare into daily routines. Gentle cleansing and moisturizing. Use pH balanced, fragrance free products to clean and hydrate vulnerable skin areas. Frequent repositioning. Shift body position every 2 hours to reduce pressure sores or pressure buildup. Okay, barrier creams. Apply protective ointments to prevent moisture related breakdowns, especially in incontinent patients. Train caregivers in compassionate touch. Encourage caregivers to use slow, intentional movements that convey care and dignity. Normalize skincare as comfort care. Frame it not as hygiene, but as a form of emotional and physical relief. Embed in toolkits and outreach. Create visual guides. Include illustrations or videos showing proper skin care techniques. Culturally adaptive materials. Use language and imagery that resonate with diverse communities, especially rural or marginalized elders. Monitor and document. Track skin integrity. Use simple logs or mobile apps to record changes and flag concerns early. Include in life review prompts. Ask elders about past experiences with touch care and dignity to inform personalized approaches. Would you would you like help drafting a caregiver module or adapting this into participatory training guide? We could even co-design a myth busting sheet around pressure ulcers in skincare. You're asking the right question, especially given your systems level lens and uh, commitment to culturally responsive care. Beyond skincare and compassionate touch, here are several evidence-backed practices that can elevate caregiving across diverse settings. Holistic practices to enhance caregiving, responsive communication and empathy. Practice active listening and validate emotions to build trust. Use culturally attuned language and metaphors that resonate with the care recipient's background. Consistent routines and predictability. Establish daily rhythms to reduce anxiety and foster a sense of control. Guys, you always want to make the your dying person that you're helping. You always want to make them feel like they're still a person. Okay, that doesn't go away until they pass. That is my personal preference when I'm helping somebody pass. I want to give them as much dignity as possible and as much control as I can still give them as a person. So that matters. Okay, next page. include rituals that reflect cultural or spiritual values like prayer, storytelling, or music in their process. Caregiver support networks build peer support groups or digital communities that reduce isolation, offer respite care options, and mental health checkups or check-ins for caregivers themselves. Technology integration. Use medication management apps, telehealth, and wearables to monitor wearable monitors to streamline care. Co-design toolkits with caregivers to ensure usability and cultural relevance. Life review and narrative practices. Incorporate module prompts for storytelling, legacy building, and intergenerational dialogue. Use trauma-informed approaches to honor difficult histories without re-traumatization. Environmental adaptation. Modify physical spaces for safety and comfort and cultural familiarity. Include sensory elements like familiar scents, textures, or visual cues. Evidence-based tracking or training. Provide caregivers with training in emotional regulation, dementia care, and harm reduction. Use participatory methods, role play, case studies, and community feedback loops. Policy and advocacy integration. Empower caregivers to engage in local policy efforts around aging, infrastructure, and equity. Include caregiver voices in program design and evaluation. Would you like to co-create a framework that blends these into a toolkit or training module? We could tailor it for rural caregivers, dementia support, end of life care, what aligns with your current focus. Culturally, adaptations in caregiving aren't just thoughtful, they're transformative for someone like you who's deeply invested in equity, participatory design, and myth busting. The benefits ripple across individual, community, and system levels. Here's a synthesis of key advantages. Benefits of cultural adaptations in caregiving. Improved health outcomes. Tailored care increases treatment and treatment adherence and reduces complications. Culturally, congruent communication helps identify symptoms and concerns earlier. Okay, enhance trust and rapport. Respecting cultural norms fosters emotional safety and relational depth. Elders and families feel seen, heard, and valued, especially in marginalized communities. Reduced health discrepancies. Adaptations help close gaps in access, diagnosis, and care quality for racial and ethnic minorities. For example, culturally compliant dementia care has shown better engagement and reduced caregiver stress, greater caregiver confidence and effectiveness. Training in culturally humanity and respectfulness equips caregivers to navigate diverse needs with empathy and skill. Mindfulness-based approaches improve emotional resilience and reduce burnouts. More inclusive and personalized care plans. Rituals, dietary preferences, family roles, and spiritual beliefs are integrated into daily routines. This leads to care that feels affirming rather than intrusive. 6. Community empowerment and co-design. Cultural adaptations open doors for participatory frameworks and community-led innovation. They validate lived experiences as expertise, something you champion beautifully. Would you like to build a benefits framework for specific toolkit or training module? We could even map these benefits to stockhold incomes or outcomes, elders, caregivers, policymakers to support advocacy and funding? Okay, great question. And one that sits right at the intersection of your systems thinking and commitment to equity. Measuring the effectiveness of cultural adaptations in caregiving requires both rigor and nonsense. Here's a structured framework to guide evaluation. Measuring effectiveness of cultural adaptations in caregiving. Psychometric validation of adapted tools. Use validated scales like the caregiver self-efficacy in contributing to patient self-care. Case CSC, which has been culturally adapted and tested for reliability, validity, validity and measurement, uh, and variance in Chinese caregiving contexts. Apply classical test theory, e.g., cone box alpha testing, resistant reliability, and item response theory, reach modeling to assess how well adapted tools perform across diverse populations. Outcome-based matrix. Clinical outcomes track changes in patient health, e.g., fewer hospitalizations, improved symptom management. Caregiver outcomes measure stress, burden, and self-efficacy before and after adaptation. Engagement matrix. Monitor participation rates, retention and satisfaction in culturally adaptive programs, quantitative feedback, and participatory evaluation. Conduct focus groups and interviews with caregivers and care recipients to assess cultural response or resonance. Use community advisory boards to co-interpret findings and refine adaptations interactively. Comparative case studies. Compare adapted versus non-adapted interventions in similar settings. Document differences in uptake, trust, and perceived relevance. Cultural uh, con, con, congruence indicators. Assess alignment with cultural values, e.g., familiarism, spiritual beliefs, and communication styles. Use frameworks like the social cultural stress and coping module to evaluate how cultural beliefs buffer caregiver burden. Equity impact assessment. Track whether adaptations reduce disparities in access, outcomes, or caregiver support across racial, ethnic groups. Include matrix for language, accessibility, representation, and cultural safety. Would you like to co-design a evaluation matrix or dashboard tailored to a specific toolkit or innovation you're working on? We could build in both quantitative and quantitative indicators and even map them to stockhold priorities, elders, caregivers, funders, and policymakers. Okay, guys, so that is A for you. I'll be back on shortly with B. Give me a little bit for B, please, and I'll be back on with that for you shortly. For now, Gator Wellness, take care, folks.